You know, it's interesting to me, if you're running a business, you would look at the root cause of the problems that you have and address the root cause. And for some of these families, it really is the legal root cause, but we rarely kind of think like that. But if we could, and we could say, what's the root cause of the problem for this family, and direct them to the one that can help that root cause, that would make an enormous difference. But that root cause thinking is unfortunately not the way we think at the moment. But if we did, I suspect we'd see a lot healthier populations. My name's Sharon Goldfeld and I'm a paediatrician and public health researcher. I head up a centre, the Centre for Community Child Health, that sits across the Royal Children's Hospital and the Murdoch Children's Research Institute in Melbourne. And we focus on prevention and equity. In other words, trying to prevent some of the common conditions of childhood, in particular focusing on children's health, development and wellbeing, and addressing inequities for kids. So in health, we talk about something called the social determinants of health, but what we really mean are the things that can affect health that aren't about health themselves or even about health services. And we know that, say, health services contribute only about 10% to people's actual health. So there's all this other stuff around people that make a difference. And that includes for children, for example, the families and the communities they live in. But it also means that there's a whole lot of stuff that sits outside health services that makes a difference. And these social determinants might include something like your housing, so the house that you live in. It might include things like the parks that are available for children. But it also involves the context of people's lives. It's where they live, work, play, where families bring up their children. And so the whole point about the legal aspects of people's lives when it comes into play is it affects their lives very deeply. And we know that the sort of stresses that come with legal problems affect people's mental health and their physical health, and that actually plays out for families in how they parent their children. People may not realise, but the top things that we see in children are not cancer or any of those sorts of things. It's actually things like autism and other developmental problems and behavioural problems and asthma. They're the common things we see. And it won't surprise you to know that for many of these families who have got these kids who've got complex problems, they actually lead complex lives. And a lot of these other social determinants get in the way. So if you've got a child, for example, with additional health and developmental needs, you've got to spend more on that child, you've got to try and navigate a whole system. So not only a housing system, but an education system and a health system. And then you've got to try and navigate relationships that often break down. So there's a whole lot of stuff that goes on for these families. And what we've seen, for example, in studies overseas as well, is sometimes having a lawyer in a healthcare facility just allows families the ability to address what we kind of sometimes call the background factors, the factors that actually affect a family's life. But they're kind of in the background. They may not be the reason you've gone to see a doctor, but they're the reason that can sometimes make you sick. Families don't often just have one challenge, they have 2 or 3 or 4 challenges. Those challenges might be inside the home, they've got family violence or just divorce, family functioning issues, right through to the challenges outside the home. And that includes housing, legal issues, sometimes financial legal issues, sometimes marital legal issues. These are the common problems for the same families. Unfortunately, our system doesn't work like that. You have to move between silos if you're the family, whereas really we should be looking at what are the needs of the families. And I think this has got very much some strength in the place-based interest there is at the moment. So in a community, what are the needs of those families? And then how do we orient the system around those families rather than what we have at the moment, which is the family having to orient themselves around the system? And so that's where this integrated approach comes into play. If the families could just walk through one front door that allowed them to meet a whole lot of other services that would meet their need, same families, then that would make a huge difference to that family being access what they need. And then, as a community, we could say we are actually meeting the needs of our community.